So now we're going to take a look at the internal anatomy of the heart, starting in the right atrium. So within the right atrium, we have this pectinate muscle connected to the cristae terminalis. The pectinate muscle is named that because pectinate means basically the teeth of a comb, and that's what it looks like. And it's part of the myocardium, so it has the muscle cells in it to help the atria to contract, right? Now, if you peek within the right atrium, you will see a small circle right here. This is a cluster of a different type of tissue called pacemaker cells, because this is your sinoatrial node. This is the guy that's going to set the pace, the rhythm for your heartbeat. Sinoatrial literally means sinus rhythm, so basically the normal rhythm of your heart, and then it's in the right atrium. When the SA node fires off, it's going to depolarize the heart muscle in the right and left atria, so they both contract together in a syncytium. Now, once that fires, it's also going to hit another node found right between the atria and the ventricles, and it's called the right AV node, which stands for right atrioventricular node. Once this guy gets stimulated by this SA node, it'll pause for about 0.1 seconds before sending action potentials through the ventricles, so that then the ventricles contract immediately after the atria do. So you get this kind of lub-dub contractions of the heart. So top, bottom, in that order. Now, if we look further inside of here, we see a couple other structures that are kind of cool. This one here is called the fossa ovalis, which basically means an oval-like depression. Now, this originally was actually an opening to the other atria, which was actually open during gestation, so when you were in your mother's womb. This closed up once you were out of the mother's womb, so you can actually separate out both sides of the heart, whereas it's open during gestation because it just could be. It doesn't really bother you all that much. For some people, that doesn't close after they're born, so they actually have to give it a surgically cautered, so closed up. Now, a few other structures in the right atrium. Remember, we've got a bunch of different things flowing into the right atrium, deoxygenated blood, right? So here we have the inferior vena cava. So that red circle you see, that's the opening of where the inferior vena cava will be coming into. And this is the vena cava's valve. We also have the coronary sulcus coming in here, remember from the coronary circulation, as well as its own valve. If you peek in here, you can also see the opening of the superior vena cava, drawing blood back into the right atrium. So from there, blood's going to be pumped right through the right atrium down to the right ventricle, and it's going to go through this little opening, and this is called the tricuspid or right AV valve. And then we're going to get into the right ventricle. So when we get into the right ventricle, notice one thing. We've got a lot of these lines here. These lines are called the trabecula carne, and they're going to be attached to the pectinate muscles. Those pectinate muscles are going to be attached to what's called the chordae tendineae, which are these thin little string-like structures, and these are basically the heartstrings. So when you say you're pulling on somebody's heartstrings, these are what you're pulling on, but not really. All of these connect to this tricuspid valve, keeping it open when the atria will contract, and the blood flows down here, so the valve will open up, go down here, and then it will close up when this right ventricle actually contract and push blood through the pulmonary circuit. So it's very important structures here to keep that valve open then closed, open then closed, open then closed during contractions. Now, when the right ventricle does contract, we will also be pumping blood through a valve in the pulmonary circulation. This is called the pulmonary valve or the pulmonary semilunar because it kind of looks like a half moon shape. And remember when I mentioned earlier that the SA and the AV node will be sending action potentials, so signals to the heart muscle to contract? Well, this is shown by these fibers. So this right up here, this is called the right branch of the bundle of His, okay? Once it gets through there, it's going to go down through the Purkinje fibers, which are located here, and all of these fibers are going to help depolarize this ventricle so that it can get excited to contract. So now let's look at the anatomy of the left chambers of the heart. So inside the left chambers of the heart, once again, you can see that little hole on the opposite side, which would go to the fossa ovalis on the other side. Remember, this was open during gestation. Now, inside here, we've got, remember, oxygenated blood flowing back from the lungs through the pulmonary veins, entering into this left atrium. The left atrium will contract, once again, with the help from these pectinate muscles over here, and it will go through the mitral valve. So this is the valve that separates the left atria from the left ventricle. Now, this is also called the left AV valve or the bicuspid valve. Once again, we've got the same structures. We've got the trabecula carne, we've got the papillary muscles holding on to the chordae tendineae. Once again, just holding that valve open, then closed, very important structures. Furthermore, we also have the same exact nerve fibers coming down through here. This is the left bundle branch, and then these are the left Purkinje fibers. Once again, depolarize the left ventricle so that it gets excited to contract, and when it does contract, it's going to go through, if you can see it, that valve back there in the heart. That is called the aortic semilunar valve. The reason for that, once again, it's going through the aorta. Kind of looks like a half moon shape if you look inside of there. So that's the anatomy of the heart.